What one thing would you want to tell people with MS about your presentation on access to treatments across our European countries?
Do you know, I come from Central Europe, and we have much more problems than people from Western Europe because our gross domestic product is lower, and we are dependent on resources, and criteria for reimbursement of our drugs are mostly decided by government or governmental bodies, and therefore I would like to tell people that they have to fight for their drugs, for their treatment, because their voices are heard because they are voters. You know, we physicians may be accused from corruption by pharma companies or whatever, but if people with MS really fight for their medication, they must be successful.
And what's the best way for us collectively as an MS community to have our voices heard?
You know, you have to go to media to tell them that you want to live normal life, that there are treatments with which you can work, because if you lose work because of MS, it's a big cost for the society. So it's not direct medical cost like cost for treatment, but it's the whole cost for the society, and it is very high, especially in higher steps of disability.
Brilliant. And some points that you made throughout your presentation, I felt that you were maybe a little bit frustrated with the barriers or the restrictions that were in place for people. What one thing frustrates you most?
That I cannot really use effective treatments because more effective drugs are more expensive, and I cannot use them properly in all people that would deserve them.
And how does the access differ across Europe?
It differs a lot. If you are in a country which is really not rich, the basic therapy is sometimes provided, not to all patients. The diagnostic procedures are not all following guidelines, so many people are not diagnosed, and if you are not diagnosed early and treated early, then the disability comes earlier and the cost is, of course, going up.
And are there any resources available for us as Europeans to try and, you know, get past those barriers?
I think the only way is that you unify our voices across countries as European body, because we should be all treated the same way in European Union, and it's not true.
And do you think it would be helpful then if the countries with maybe a stronger economy, the people living with MS in those countries kind of stood in unity with the people living with MS in countries that have a weaker economy? Do you think that kind of that would be helpful?
Do you know, we have a European Multiple Sclerosis platform, and this, of course, is an organization having all these lay MS societies in it, and they should work together to really fight for accessibility, equal accessibility to treatments all over Europe.
That's great. Thank you.